Good afternoon, everyone. Thank you for joining us for our webinar on the Doctor of Physiotherapy today. My name is Chloe Lacey and I work in the recruitment team for the Faculty of Medicine, Nursing and Health Sciences. And joining me today is Dr. Prue Morgan, our Head of Department for Physiotherapy. Before we do get started, can I just get everybody to please click the raise your hand button just to indicate that you can hear us and what we're saying. Thank you very much, I can see that. The other thing I wanted to draw your attention to was the Q&A button. So whilst we're presenting today, feel free to type your questions in. We will have an answer time towards the end of the session. So type them as you're thinking of them or towards the end, that's fine. Just please avoid using the chat button because I won't be able to access that one. So just the Q&A throughout. Otherwise, I'm going to hand things over to Prue, who's going to start off with a formal presentation, and then we'll open up for the Q&A session. So thank you, Prue. Oh, there we go.
Okay, good afternoon, everyone. So my plan for this afternoon is I'm going to give you a bit of an overview on what is a physiotherapist and what potential careers might be available to you if you complete the degree, and then have a look at how the course here is structured, and then some more information around some of the prerequisites and the application process. So let's start by reviewing what is a physiotherapist. They play lots of different roles within our health service. Most commonly, they work with people who present with movement problems, and those movement problems might be due to pain, weakness, stiffness, or a myriad of other causes. And those people may present after disease or injury. And also we work in health promotion, where essentially we're trying to assist people to avoid disease and injury. So where do physiotherapists work? Potentially a physiotherapist might work in private practice, in a public or a private hospital, in a community centre, in a rehabilitation facility, in sports clubs and organisations, it's in schools and major businesses, for example, for Telstra or Optus or for Coles Myer. And also we work in policy development in health departments. Now, many of you may be sitting there thinking, oh, I know what a physiotherapist is because I've been to a physiotherapist. And generally, if you're young and fit and active, you may well have come into contact with a physiotherapist for assistance in managing possibly a sporting injury, or maybe you've had a parent or grandparent who's needed assistance for, perhaps they've got back pain or some arthritis. So those roles are very familiar to us. However, there are lots of other less familiar roles that physiotherapists might engage with. For example, we work in critical care, assisting patients with breathing difficulties after major trauma. We work in aquatic physiotherapy programs. We work with children with special needs and in neonatal nurseries. And we work with women in the pre- and postnatal period. And also, if you've noticed, an emerging area of physiotherapy is in fact in equine and animal physiotherapy. So if you're interested in working with animals in the future, that might be something to explore. At Monash University, we offer 2 entry to practice qualifications: the Bachelor of Physiotherapy, which is an undergraduate 4-year degree, or the Doctor of Physiotherapy, which is what we're speaking about today. And that's a brand new program that will commence in mid-2020. It's a graduate entry program and it will take 3 years to complete. So what's special about the Monash Doctor of Physiotherapy? We find that the thing that students love the most about our bachelor program is that they learn relevant physiotherapy content from week 1 of year 1, and that will be exactly the same in the Doctor of Physiotherapy. Students also only enrol in physiotherapy units, so you know therefore that everything you're learning is absolutely highly relevant to your future career as a physiotherapist. Our students, of which there will only be a relatively small number in the DPT, will form a really tight-knit cohort because every class you will do with the same group of students. So you can set up some really great sort of study groups from the very first year. All of our staff are qualified and practicing physiotherapists. We also team up with a group of great clinical educators who contribute and may teach into our program or supervise our students when they're out on their clinical education placements. There'll be opportunities for interprofessional learning, working with occupational therapists, radiographers, nurses, who haven't I spoken about? Pharmacists, yeah. So there are lots of opportunities for you to learn about what it might be like to work in a team-based environment in the future. And as I've mentioned earlier, we have, we work closely with our clinical educator partners, and we have really great partnerships with all of the major health services across Melbourne and beyond. Obviously, physiotherapy is a very practical course. You won't be sitting behind a computer for 3 years, that's for sure. Certainly a lot of what we will focus on in the early years is really developing your practical skills so that you become confident and competent in doing a number of tests, working with people, assisting people to learn to move again after injury or disease. We've structured our early year learning into being very focused around case-based learning. That means, for example, each week you might be presented with a typical example of a patient who presents to you as a physiotherapist. So let's say, for example, a person who injured their knee playing netball on Saturday. You're the physiotherapist on Monday morning. What do you do? Each week we will scaffold amongst that case information that's relevant to the applied anatomy, the biomechanics of the knee, the physiological responses to trauma, potentially how to learn to assess the knee for ligament integrity, evidence-based interventions for maximising knee rehabilitation outcomes, and maybe also you might touch on some of the psychology of return to sport. So that's all packaged within a single week's learning. We have fantastic facilities here at Peninsula campus that are custom designed for our physiotherapy prac classes, and you'll be able to access all of them when you're here on campus. So let me tell you a little bit more about the Doctor of Physiotherapy specifically. As I said earlier, it is a 3-year course, full-time, mid-year intake. We're only offering it at Peninsula campus, and as I explained earlier, it's designed around what we call an integrated curriculum, so where you learn anatomy, physiology, practical skills, physiotherapy theory, all sort of packaged together. As well as those basic physiotherapy skills, there will also be a focus on the development of leadership, education and advocacy skills that will allow you to advance your practice. We estimate that there will be around about 18 contact hours per week, plus additional self-study time. So you need to think long and hard about how you're going to be able to manage that if you have a lot of commitments outside of your studies. As well as campus-based content, there'll be an opportunity to engage with work-integrated learning placements from early on in the program, in fact, from the very first semester. And as I indicated earlier, you'll share our custom-built facilities with the Bachelor of Physiotherapy students. Here I've outlined the units of study. I won't go through those in detail right now, but hopefully you can see that as you progress through the course, you'll gradually move from doing a lot of campus-based content into more clinical placements. And in fact, In the second half of the course, the last year and a half or so, you will be doing a significant amount of time undertaking clinical practice out with our clinical partners in a range of facilities. So what does that clinical education involve? There will be almost 1,000 hours of clinical education that our DPT students will complete. That includes not only clinical placement opportunities, so that's out with our clinical partners, but also what we call work integrated learning opportunities, which is where we get you going out quite early, and I'll talk about those a little bit more in a moment, and also some simulation. So that work integrated learning, as I said earlier, we do immerse you in the workplace from the very commencement of your study. So from year one, semester one, you'll have some regular visits where in fact you're going out to observe physiotherapy practice in a range of settings. For example, private practice, in hospital and aged care facilities. What's simulation? Simulation is again an opportunity for you to practice your skills in a safe environment before we sort of let you loose on real patients, if you like. And here are a number of our Bachelor of Physiotherapy students and my staff donning some of the simulation costumes that allow a really realistic engagement with some simulated experiences, such as, you know, working with a patient who's had a stroke, or working with a patient who might have had a hip replacement, or working with a patient who may have a chest infection. And our students certainly really love those opportunities. So what are the selection requirements? You do need an Australian undergraduate degree in a relevant area of study. For example, a Bachelor of Biomedicine or a Bachelor of Science. And the three important subjects that you need to have covered off are human anatomy, human physiology, and biostatistics. And certainly you need to be aiming for a minimum distinction average in those subjects. But also bear in mind that it is a competitive process. So just having a distinction average does not necessarily guarantee you a place in the course. So what if you don't have all of those units covered off? Certainly, as I said, initially you do need to have an undergraduate degree in a relevant discipline. You need an average grade of at least 70 with the prerequisite study areas, and we invite you to apply directly to Monash via the Find a Course button on our website. If you'd like any further information about the program or about physiotherapy in general, we certainly encourage you to go and have a look at our website where a lot of additional information is provided. And just a note that due to the integrated nature of the Doctor of Physiotherapy curriculum, credit for previous study is rarely awarded. Now, if you have not completed the prerequisite subjects for the Doctor of Physiotherapy, then you will not be eligible until you've met that criteria, and therefore your application will not be able to proceed. Once you have finished your Doctor of Physiotherapy, you will be able to register to practice as a physiotherapist. So if you like, you can go home, put a sign outside your window saying open for business, with council approval, of course. But you know, there are no other internships or any other qualifications or courses or training that are required. The 3 years of the Doctor of Physiotherapy allows you to practice anywhere in Australia and in many other countries overseas. Now, I've noted there that at the moment, through the registration board, we've been granted provisional approval, and that's only because our course has yet to start. But we do not anticipate any delays in signing off on that final accreditation, allowing you to register to practice. Again, if you would like further information, here's the phone number and also our website address. And here is some of the information that you can find available on our webpage. I hope that's helpful, and now I welcome questions.
Thanks very much, Prue. Just go on the screen. So we're in full view now. So just opening up to our participants now, if you've got any questions, you can feel free to type them into the Q&A section there. We'll see them pop up and answer them on camera for everyone. Don't be shy, there's no such thing as a silly question. We've done lots of these, and quite often people are often thinking the same thing. So we've had one come through. Do we have CSP places available, or is it full fee?
It is a full fee paying course. There are no CSP places available in the Doctor of Physiotherapy.
Thank you. Is mathematical methods required? So that's an undergraduate degree requirement, but not relevant to the doctorate?
No, not necessarily. As long as you have human physiology, human anatomy and biostatistics, you're welcome to apply.
Thank you very much. What advantages does Monash offer, let's say, in comparison to Melbourne's Doctor of Physiotherapy?
I obviously can't comment on the University of Melbourne's program, and I certainly encourage you to go to their website and/or open days. I guess what we're offering here is a new program, so it's brand new. So it's had an opportunity to essentially, develop a brand new curriculum. It's had a lot of input with our clinical partners. So in fact, we can be confident that the product, if you like, the graduate competencies are absolutely meeting our workforce requirements. And again, I would suggest that the work integrated learning opportunities that we're building in are possibly also a point of difference.
Thank you. Would we say the course is suited to someone who's not currently working in the health industry but is interested in making a change?
Certainly, if you're not currently working in the health industry, if you've got a passion for health and if you've met the prerequisites, then absolutely we invite you to apply.
So could those potential students look at doing single courses to meet some of the entry requirements?
So you do, we've had a few previous queries where perhaps someone may have only got 2 out of those 3 prerequisites. So, for example, they've got human anatomy and human physiology, but they haven't got biostatistics or vice versa. So you do need at least 2 of those 3 prerequisites in your undergraduate degree. If you're missing one of those prerequisites, then we welcome you to cover that off as a single unit enrolment. But if you're missing more than two or more of those prerequisites, then unfortunately you will not be eligible.
Is there an interview as part of the selection process?
No, there is not.
No interview. If a student was to apply in January, when will they likely know whether they've been accepted?
We will process applications on a first come, first serve, so there is no ranking. In order that we receive them, if we have all of their documentation and they have met eligibility, they will receive an offer.
So they could find out as soon as January or soon after?
In probably about a 3-week window.
Yes, okay, 3 weeks. Thank you, Vanessa. Is there any study, so the course, I can answer this one, and that's, do we study at Clayton? Because undergraduate students do take anatomy at Clayton 1 day a week. Is that the same for the Doctor of Physiotherapy?
Yeah, so because the anatomy in the Doctor of Physiotherapy is a prerequisite, there will be no requirement for you to do additional anatomy up at Clayton. So our Doctor of Physiotherapy students will not be going to Clayton 1 day a week.
Yeah, because you'll already have that covered.
Yes, yeah.
Yeah. Work placements in the course. Can we circle back to what workplace?
Yeah, so you end up doing around about 1,000 hours of clinical placements which may include the work integrated learning that are early in the course. So they may be placements at private practices or residential aged care facilities, for example. As you move through the course, your more formal clinical placements will occur, and that may, I think there are 4 5-week placements in the course, and they occur with any of our clinical partners. So, for example, you might spend 5 weeks at Monash Medical Centre, and then 5 weeks at Kingston Rehabilitation Facility, and then 5 weeks in a private practice, and then another 5 weeks at the Alfred Hospital. So depending on the student, you'd have sort of a range of clinical placements that you would need to complete before you signed off on completing your course.
Are you able to put a preference in for placement locations and things like that, or is it kind of random selection?
Certainly we invite applications for preferencing only if you live outside of Melbourne. So, for example, at the moment, we have placements available in the Gippsland region, we have placements available in Tasmania. Some students may think, oh, I really want to go to Tasmania, or some students may live in Tasmania, in which case they're welcome to preference. But unfortunately, if you live in Melbourne, it's sort of a bit of a random allocation.
Yeah, thank you. Is there an application deadline? Is that something?
So I'm going to have to get Vanessa to answer this one.
No, there isn't an application deadline, only because it is a new course. And but like Prue said earlier, there are limited places available. So I think as soon as we've met that, filled in all of the places, we will close. But as of now, there is no application deadline. We just encourage people to apply as soon as possible, and not wait. If you are interested and you think, even if you think you're not sure whether you meet eligibility, unless we have an application, we can't really assess it.
Yes.
So for domestic applicants, it is free. You don't need to pay an application fee. So, put your application in there so we can assess it.
As soon as possible. Thank you. Let's say a student hadn't achieved a distinction average in a relevant undergraduate degree, but completed an advanced diploma in an area of relevant study. Is that something that will be taken into consideration?
Unfortunately, Monash requires an undergraduate degree as part of the selection criteria.
Okay, so they'll be looking at that, the diploma or grad certs won't be taken into account?
No.
Okay. Do we issue conditional offers? So let's say they're completing a relevant undergraduate degree mid-year. Is it possible to be offered a place, or do you need final results but in a timely manner before the course is actually starting?
We are hoping that we won't need to issue conditional offers, only because we are opening the course at the beginning of January, by which time most applicants who have are just finishing the undergrad wouldn't have their results.
Yeah.
Also, we will take that decision on a case-to-case basis. If you have met all of the prerequisite areas of study in your undergraduate degree, which you are still doing, we are likely to issue a conditional offer, but not on actually doing a single unit enrollment.
Okay.
So if you need to do any of the prerequisite areas, you will need to do that prior to applying for the course.
Okay. So on a case-by-case basis. So still apply, put your application in.
Yes.
But there's no guarantee.
Yes.
Yeah. Are applications already open?
No, they will open on the 1st of January 2020.
Okay. So that's all right. We just had the same question again. So applications open January 1st, 2020. How many domestic places are available in the program? Do we know that?
So for 2020, there'll be around about 25 to 30 places available, and we will gradually increase the number of places over the years.
Yep, as the course grows.
Yep.
So can I just, I've had a question come through, can we submit our application? I'm just I need a little bit more information there. You do submit your application directly to the faculty. So if you go on to find a course and look up the course page, you'll have all of the information there for what you need to submit and how to go about the process, but I'm not quite sure what other information for you're looking for there. Maybe if you can just expand on that question for me. How big is the DPT cohort, which we've just answered? We're starting off with 25 to 30.
So there will end up being around about 35 students in total, but as I said, we're aiming to grow over the following years.
Yeah. Which just it means you'll know your colleagues very
Yes,
well.
absolutely.
Which is a nice thing. Would an honours degree's marks be taken into account?
Yes, yep.
Yeah. Okay. I'll just give out, oh, here's another one. Is it possible to defer if I happen to get into honours next year?
No.
It's not?
No, because of the limitation on the number of seats available.
Yeah.
For this year, we might change that for the 2021 intake, but for the first intake, we will not be deferring any offers because the interest is there, and in fairness to everyone else applying, decided no deferrals for this first intake.
Okay, thank you. I'm just going to give it another minute or so in case participants have got any other questions for us. Feel free to type them in. Was there anything else at this stage for you wanted to add? Or it's a good sign if questions are wrapping up soon. It means we've answered everything. No,
just that, obviously we've run the Bachelor of Physiotherapy program here for many years, and a lot of the same educators who are teaching into the Bachelor program will also be teaching into the Doctor of Physiotherapy program. So you can be confident that even though it's a brand new program, you will have highly experienced staff educating you.
Fantastic. And we've had one more. If the bachelor's degree a student's completed wasn't in a relevant area, but they did complete the prerequisite subjects and have since completed graduate level exercise physiology degree, would that meet requirements provided they've got that distinction average maintained? So they've done a different bachelor degree, so it's not in a related area, but they have covered off all the prereq subjects and then have done a graduate level exercise physiology degree.
I would think as long as that we can see that they've covered off the equivalent of undergraduate units in human physiology, anatomy and biostatistics, then certainly we welcome an application.
Yeah. If your circumstances, if you're not quite sure, do feel free to reach out to Monash Connect. They'll put you in touch with our admissions team or with staff within the Department of Physiotherapy to answer questions. And if all else fails, put an application in anyway and you'll be assessed. It doesn't hurt to do so, it's free. So, what is the difference between I think she means the Bachelor of Physiotherapy and the Doctorate of Physiotherapy?
Yeah, that's a really good question. At the moment, you may be aware that in Australia, at the moment, you can do a Bachelor of Physiotherapy, you can do a Masters of Physiotherapy, or you can do the Doctor of Physiotherapy, which is a Masters extended. All of those degrees teach you what we call entry to practice standard physiotherapy skills. However, the difference between the Bachelor of Physiotherapy program that we run here and the similar programs that are run around Australia and a Doctor of Physiotherapy is, in addition to having your entry-level physiotherapy skills, you will also have additional skills in leadership, education and advocacy. And our clinical partners and workforce is suggesting those skills are really valued. So that's why, as well as being a physiotherapist, you'll have sort of those value add skills, which we would hope will allow you to sort of rapidly assume sort of expanded areas of physiotherapy practice in the future.
Mm-hmm. And do you get the doctor, obviously the doctor title?
So it's a Doctor of Physiotherapy, but you cannot call yourself a doctor. So it's not like Dr. Morgan, because that's reserved to people who've done a PhD.
Okay.
But you can absolutely call yourself, Prue Morgan brackets, Doctor of Physiotherapy.
Yeah.
So it's a subtle difference, but it's an important and it's a really good question.
Yeah, and then compared to a master's program that's extended. So
So the same thing that a sort of traditional master's program doesn't allow you to develop those additional skills. So it sort of just provides you with the entry to practice physiotherapy skills in a slightly more condensed way.
Yeah, okay. Thank you very much. Well, we haven't had any other questions come through, so I think at this stage we might wrap things up. Everyone will get a copy of the recording sent out to them, a link. So, and as we said, so you'll be able to refer back to the slides, refresh information, see the contact information. Feel free to reach out to us, and thank you for joining us today.